Divine, new tonight, a growing hole in the safety net for our children. The number of Arizona doctors who provide free childhood immunizations is shrinking, and that's making it harder for lower-income families to get the shots that prevent deadly diseases like measles. 12 News journalist Bram Resnick explains why doctors are leaving the immunization program and what's being done to bring them back. Bram?
At Caribe, Arizona school children have one of the lowest immunization rates in the country. Sadly, that is not news. State law allows parents to get personal exemptions for required vaccines. In recent years, the anti-vaccine movement has had an impact too. Now we're learning that parents who do want to immunize their children are having a harder time getting those shots.
Back in the day, if you go back 10, 12 years, we wouldn't be doing this interview.
Will Humble is a former Arizona public health director who oversaw the Vaccines for Children program.
We've lost half of those folks that were actually providing vaccines.
The federally funded Vaccines for Children program provides free vaccinations to children whose families might not be able to pay for them. Doctors in the program must follow federal and state regulations.
The Vaccines for Children's program is really a lifeline for those marginalized communities.
Dr. Andrew Carroll is a family practitioner in Chandler who participates in the Vaccines for Children program.
For those kids, those infants and toddlers to get the vaccines they need at the very young ages. These communities don't have access to healthcare services for the most part.
Carroll says many doctors leave the program because federal compensation doesn't cover the administrative burden.
We may have turned the corner, but it reminds me of the old proverb, trust but verify.
Humble is encouraged by a new independent report this week that lays out the program's problems and highlights how the State Department of Public Health can fix them.
In the meantime, it's probably going to stay challenging for some families to get their kids vaccinated.
And the Arizona Department of Public Health didn't respond to a request for comment. Let's send it back to you.
Okay, Bram.